Good morning, everyone. Well, for those of you who it's morning, welcome. We are lucky today. We have two speakers who are going to be speaking about climate change and health equity, Dr. Lisa Patel and Amanda Millstein. And we're fortunate because they're also both UCSF alum. So Lisa's the current executive director of the Medical Society Consortium on Climate and Health and an associate professor of pediatrics at Stanford, but we will still claim her as our own. She's also the executive committee for the Council on Environmental Health and Climate Change for the American Academy of Pediatrics, and there's a lot of amazing advocacy work through that. And then Amanda, as well as a UCSF alum, currently working at UCSF Benioff Children's Hospital. So for those of you who rotate there, you may have run into her. She's a primary care pediatrician and a co-founder of the Climate Health Now organization, which organizes and mobilizes the California health community around equitable climate advocacy. And she's also the co-chair of the AAP Chapter 1 Committee on Climate Change and Child Health, which I think is open to any of those of us who are AAP members, right? Okay, well, great. I'll let you guys take it away. And just to say, this is always a talk that both inspires and scares me. So get ready.
Awesome. Teresa, thanks so much for having us back. We have nothing to disclose. And you can move to the next slide. As Teresa outlined, both Amanda and I were 1 year apart in residency, and we reconnected in 2019 when a lot of the youth movement started organizing around climate change. And I love coming back to this lecture every year. I was actually a global health pathway resident in addition to being a pediatric resident. So yes, I still claim UCSF as my own. I apologize if I'm slightly incoherent. We had a medical leave, so I had to cover a 24-hour shift yesterday. But I hope you all will bear with me. So we're going to talk a little bit about why, and we're going to break up this talk a little bit. I'm going to give the first half, and then I need to get on the road home, and then Amanda's going to give the second half. I'm going to talk about the health impacts. Amanda's going to talk about advocacy opportunities. So we're each going to talk about why we do this work, and I'm going to focus specifically on climate change as a health crisis, and how these issues are national, local, and also global as well. Next slide, please. You can just skip to the next slide. So I often get asked, like, how did I get started in this work? And the story really stretches back. Most climate advocates will tell you that there was a light bulb moment. We are kind of bathed in this information every day. And one day, a lot of things fall into place for folks. And they're like, how did I not see this before? And they really start devoting more of their time towards this issue. For me, it stretches back a little farther than that. I was about to start college, and I was working in Barnes & Noble. And that summer, Contact by Carl Sagan came out. And for anybody who's not familiar with Carl Sagan, he was just an amazing astronomer, science communicator that wrote these amazing books about why our Earth is so special and unique, especially when you take a step back and think about how we may be the only intelligent life on this in this universe. We really haven't found evidence otherwise to date. And there's a book in particular that goes through, like, if we as humans, if we stepped on different planets, what that might be like, to drive home how special and unique our planet is. And so places like Venus actually had an Earth-like climate until volcanoes caused significant climate change, and surface temperatures there are now 450 degrees Fahrenheit. Well, in college, I studied environmental science. My father's a doctor. In the back of my mind, I was like, maybe I'll be a doctor. I don't know yet. And then I worked for the EPA in India, where I was working on a lot of air pollution issues in particular. And all of this started to come together for me. I decided to go to medical school because I saw something in the links between environment and health, and I articulated that well enough to go through medical training, but then came out the other end of it. And frankly, I felt a little lost for a while trying to find my way in the space, because although there were people doing research in the space, there was no concrete way for me in terms of my career to leverage my voice. You can click on the next little clicky. And then I became a mom, and a lot of things changed in that time period. In 2017, we had a change in administration. Instead of moving forward on climate change, we took 12,000 steps back. We withdrew from the Paris Climate Accord. And although at the time, I wanted to focus on being a new attending and a new mom, I realized that unless I leaned into this work now, not just leaned in, like really made it my life's work, I brought these children into the world. I was responsible for them, and I couldn't leave them a burned planet. And so I turned to doing all of my career on climate change and health. And I love this quote by Carl Sagan: "For small creatures such as we, the vastness is bearable only through love." Next slide, please. So I could talk, Amanda and I could each talk for like days about the various ways that climate change affects human health, and why it is profoundly an issue of health inequity, both in this country and globally. I'm just going to focus on the first two for today, because I think it's really important that that when we think about climate change, it's such this big amorphous problem, that I like to make it really personal to how we are experiencing it here in the Bay Area. And so I'm going to focus on air pollution and extreme heat in particular, but this graphic is just to drive home the point that climate change is itself a threat. It is a health threat multiplier, and we are already seeing it play out in a number of ways throughout the country and the world. Next slide, please. This is just a survey of a few of the disasters we've seen over the last few years. And I feel like these days you really can't open major news outlets like AP or CNN or New York Times or Washington Post and not see a new climate disaster play out in a new place. So here are just a few examples. Severe drought and poverty put 1 million people on the brink of famine in Madagascar. There were stories of people having to eat locusts for nutrition because food was so scarce. Worsening monsoons, driving floods and mudslides in places like India, where hundreds of people were dying, let alone the heat waves that are happening there that will drive places in South Asia and the Middle East past the survivability threshold. We'll talk about what that means. We can expect many island nations to disappear, if not in our lifetime, certainly in the lifetime of my children and Amanda's children. Historic monsoon season. This is from a couple of years ago. 1/3, y'all. 1/3 of Pakistan was underwater, and tens of millions of people remain displaced from how their homes and their villages were completely destroyed by these historic monsoon events. And that's because the air is warmer, it can hold on to more precipitation, so it just dumps all this water on places. And we're seeing that play out in parts of the US as well. And then this, last year broke records, which broke records from the year before, and then this year broke records from last year. You see a theme here. So Europe also saw some extraordinarily hot days, as did the United States of America. Next slide, please. So I was a global health pathway resident, and I've done a lot of work all over the world, and thought that when I finished residency, I would continue to do work in the global health space by working in other countries. And then when we withdrew from the Paris Climate Accord, I had this total epiphany, where I was, if climate change was what I really cared about, I realized how much work I needed to do to get our own house in order in this country for a lot of reasons. The biggest one was a moral reason. The United States, if we consider the atmosphere like a cup, of how much we've filled it with carbon dioxide, we have historically been responsible for a quarter of that, and that's not going away anytime soon, right? Like that is contributing to the warming we're experiencing now. So you will hear this tired talking point from some conservative think tanks and politicians that will say, well, we're doing more than China. Well, but it's also like, we did a lot of damage ourselves and we need to be responsible for that. So in 2017, a lot of great work went into really doubling down on what we needed to do around climate. We rejoined the Paris Climate Accord, which was wonderful. We signed 3 pieces of important climate legislation, including the Inflation Reduction Act. All of these things set us on the right path but we still have a ways to go. Scientists have decided that 1.5 degrees is what we need to avert catastrophic warming. 1.5 isn't really, frankly, a scientific number. It's a political one. It's it's like negotiating with your toddler, frankly. Like, what can we all agree as like the lowest common denominator that we can accomplish? Because even at 1.5 degrees, which we briefly reached last year, and that's what we think we can adapt to, mind you, we're on a trajectory to blow past that to 2.2 degrees of warming. And we think that past 1.5 and certainly past 2, these are temperatures that which human civilization as we know it cannot adapt. And so while legislation like the Inflation Reduction Act sets us on the path to a clean energy economy, there's still so much more that we need to do to ensure a healthier world. Next slide, please. So first, I want to talk a little bit about heat waves. I think all of us at this point are familiar. I'd be surprised if anyone here has not experienced an extraordinarily hot day, either where you're from. How many folks are we have in the call? I would just love if folks just would put in the chat there what if other places either you've been in other countries or even at home, what your experience has been like in terms of extreme heat. I'd love to sort of see or hear what those experiences have been. This graphic here, this yellow one about all-time record set. Sorry, right now I work for one of Stanford's community hospitals in Pleasant and Livermore. 2 years ago, you can see the temperatures topped about 116 degrees. I've worked through the pandemic. I will tell you, I was working, where holidays for attending physicians is that you get to work a whole holiday weekend. So I worked 2 24s over Labor Day weekend, and it was two of the busiest shifts I feel like I've had in years and years. We know heat drives things like dehydration, particularly in babies, athletes, outdoor workers. It also drives poor birth outcomes. And so it was like a madhouse here in the hospital for everything that we were dealing with. The picture up on the right is severe drought in places like the Middle East. And then up on the left, it gets so hot in India, it literally warps the roads. Next slide, please. Again, just to drive home, what we went through this past summer, 265 million people. So that's a vast majority of this country experienced days that were hotter than 90 degrees, which is unprecedented. There's a little bit of debate whether Delhi actually reached this temperature of 52.9 or whether the sensor just broke. But either way, Delhi exceeded numbers that it had never seen before. We saw cities smash records all around the world. Predictions are that if climate change goes unmitigated, deaths from heat globally could be on par from all infectious diseases combined by the end of the century. Next slide, please. So what is it like to be treating patients in the midst of a heat wave? I like this coverage. This is 3 years old, but I think it gives a good snapshot of what it's like, especially because our public health response frankly just hasn't had the funding to keep up with the response that we need. Physicians race to provide fluids to patients who arrive breathless, dizzy, and drenched in sweat. Others were brought in on stretchers, their body temperatures so high their nervous systems had shut down. Those who could still speak told of stifling apartments and sun that made their skin sizzle. Some had tried to walk to county cooling shelters only to collapse in the blistering heat. I mentioned the survivability threshold. So they've actually studied human physiology for like, what's the max we can actually handle, right? Down to a protein level, down to a micro level. Our proteins, fats, carbs, everything that works in our body has evolved within a certain temperature threshold. And so what we've learned is that for humans, our survivability threshold is 115 degrees with minimal humidity at rest, drinking water continuously in light clothing, and it blew through those numbers in many parts of the world. So we are exceeding what we consider what is survivable for humans on parts of the earth, which again is kind of inconceivable. Next slide, please. I don't think this is a surprise to anybody here, but globally, the urban poor will be hit the hardest by heat. This is for a variety of reasons, whether it's the type of work that people undertake outdoors, whether it's access to air conditioning, which is much poorer in places, especially in the global south. We estimate that about 2.4 billion person days of heat wave exposure per year compared to 1.7 billion previously. And so we often say that climate change will be experienced first and worst by those who did the least to contribute to the crisis. Next slide, please. As I've mentioned, climate change is not playing out equally in all places. And I think a really good example of that is the heat wave in Chicago in 1995, when a disproportionate number of Black Americans died compared to their population in the entire city. NRDC actually went and did some community surveying along with the city and found out that there were a number of residents that reported not feeling safe opening their windows because they lived in over-policed neighborhoods. So people literally baked inside their homes. And so we have to start thinking about what structural factors make people more vulnerable, whether it's racism, whether it's a disinvestment in terms of where places are measurably hotter, and which communities either can't afford air conditioning, or even if they have air conditioning, can't afford to actually turn that air conditioning on because of energy insecurity. So those are a few of the structural issues we have to think about. And then we think about the populations that are vulnerable by physiology. So as I've mentioned, infants are more vulnerable because they can't thermoregulate. The elderly are similarly vulnerable because their physiologic mechanisms to sweat are not quite the same. Individuals with disabilities may not be able to move to a place where they could be cooler and might be reliant upon medical equipment, which in a black or brownout could make them more vulnerable as well. And then I mentioned pregnant individuals, incarcerated individuals as well. There were just some horror stories of individuals who were incarcerated that were subject to extreme heat in the last few years. Next slide, please. Then we think about the fact that we have a housing crisis on our hands, and the housing crisis makes individuals experiencing housing insecurity particularly vulnerable during extreme heat events. I think we're doing much better than when I started talking about this issue a few years ago. This was in the midst of the pandemic when public areas of cooling were closed. And we'd have these exceptionally hot days, and it was a crisis in the counties of where people would go. All of this has become as extra difficult because of the Supreme Court decision and the actions that Governor Newsom is taking on individuals that are experiencing housing insecurity. I have, frankly, have not had a lot of time to delve into how all of that is going to interplay with climate change, but I think it's an issue to be thinking about as California is taking this new tact towards its crisis on housing and individuals who are experiencing housing insecurity. Next slide, please. And then finally, the heat island effect, as I've mentioned. There's a study that every city has a different history about how redlining has played out in terms of what kinds of inequities we see. So there was a study that actually showed that there was not a consistent association between redlining and poorer tree canopy, for example, but there was definitely a signal for certain cities in the country. I do like this statistic that looks at heat island effect and income. This is from Oakland, places that are poorer, measurably hotter. And then this is a map of redlining in San Francisco. And this follows a lot that we know about what redlining has meant for areas in terms of systemic disinvestment. And one of them is that there tends to be less green space, less urban tree canopy. And so on top of the fact that communities that are poorer may not have access to air conditioning, be able to pay those bills, these areas are measurably hotter because things like pavement hold on to that heat and make it hotter for residents living there. Next slide, please. So as I mentioned, there are a few populations that are more vulnerable to heat. Pregnant individuals are at higher risk for adverse birth outcomes. I've treated a number of infants over the year in the hospital. Either the parents didn't have access to air conditioning, and so their babies overheated in their homes. I've now learned it is part of my standard counseling. I treat all the I take care of all the federally qualified health center patients in our newborn nursery that go to our FQHC. And so it is now a part of my standard counseling at discharge to ask them if they have access to two things, air conditioning and an air purifier. And we'll talk about the air purifier in a bit. And I actually found there was a family when temperatures were like 115 degrees here that were taking their brand new baby back home and they did not have air conditioning. And so social work worked with them to talk to find a relative that they could stay with, because sending a newborn to a cooling center is not an appropriate place for a brand new mother and their baby to be. And then outdoor workers do not have the same protections in place. There's actually a new rule out by OSHA that we at the consortium are working with a number of major health organizations to make sure that the health voice is mobilizing to make sure that that rule passes. As you can imagine, the industry is pushing back against it hard because they don't want to be told what to do. But in the vacuum of rules, we've seen so many, not just outdoor workers, but workers that work in spaces like warehouses collapse and die from extreme heat because neither the awareness is not there and the protections are not there. So it's important for us to protect those workers. Next slide, please. Um, when we burn fossil fuels, two things happen. First, we release carbon pollution that is driving climate change. But the other thing that gets released is particulate matter pollution. And we know that heat and air pollution are drivers for poor birth outcomes with marked racial disparities, particularly in Black and Hispanic women. And I cite this paper often because it is really sobering. Now, we think that the reasons for this are multifactorial, but there is a combination of higher exposure to air pollution from redlining, poor access to prenatal care, and then, of course, the toxic effects of racism on a mother's health. My colleague, Nsé Witherspoon, who leads the Children's Environmental Health Network, calls babies that are born in these areas that are subject to more pollution pre-polluted, because we know that this pollution crosses the placenta into a developing fetus's lungs, brain, and liver. Next slide, please. I'm going to just briefly talk about wildfires because I'm going to leave a little bit of time for questions and then have a chance to turn it over to Amanda. This slide, this is from the 2018 fires, which, if you can believe, these images felt remarkable then. And I keep these slides year after year to say, in 2018, people were blown away by this, but we've become numb now. I think that we've seen so many images of destruction. We're seeing these plumes of smoke in the sky that you can see from space. And it starts to feel like, okay, another year, another wildfire. But I never want us to think that this is normal. This is not normal. Next slide, please. If carbon emissions continue unabated, so let me just instill some hope in here that we are not going to experience this worst case scenario because we passed the Inflation Reduction Act. However, the IRA could be repealed depending on the outcomes of next year's election. So we are on a more hopeful path, but not on a certain one. And if we don't cut our carbon emissions, we can expect that wildfire smoke could be the most predominant form of air pollution we are breathing by the end of the century. Certainly because of wildfire smoke, we made significant gains in cleaning up our air after the Clean Air Act. Wildfire smoke is beginning to erase those gains from how much wildfire smoke is in the sky. Next slide, please. As I mentioned, the thing to be really concerned about, and it drives me batty bananas that we spend so much time learning about the Krebs cycle in medical school, and we do not learn about particulate matter pollution, which drives more deaths per year worldwide than tobacco does. This is a form of pollution we should all know about as health providers, no matter where you are, because pollution, both outdoor and indoor, is a killer. So we have tons of evidence, this graphic below, about what PM 2.5 pollution means for long-term health when we're burning fossil fuels. So premature mortality, stroke, heart disease, asthma, lung cancer, reduced lung function, low birth weight. Trouble with wildfire smoke is that we think that it is 10 times as harmful to health compared to other types of air pollution. This was a study that took apples to apples. You took an air quality index of 50, if it's fossil fuel pollution that we're always breathing because we burn fossil fuels, Or you take an air quality index of 50 if it's wildfire smoke. 10 times as many children showed up for that same amount of pollution when the nature of the pollution was different. This shouldn't surprise us. When a wildfire happens, right, we're talking about chemicals in your home that are ending up in flames, metals that we're breathing in that are more toxic and more carcinogenic. Next slide, please. What we see during periods of wildfire smoke, once again, we have to think about who's vulnerable and how they're vulnerable. So children, older adults. This is a tweet from the governor of Oregon that I like, that very simple graphic about who needs to pay attention. I would add to this list of folks, pregnant individuals as well. What I see is a pediatric hospitalist during periods of wildfire smoke, where we see more respiratory infections like pneumonia. We see more asthma exacerbations as well. Next slide, please. As I mentioned, fossil fuel pollution causes 8 million premature deaths per year, more than tobacco globally. There was a study out of Harvard that said fossil fuel pollution was responsible for 1 in 5 deaths worldwide, which is, once again, when we think about the fact that, well, we didn't have other forms of energy 100 to 150 years ago. Maybe it made sense to burn fossil fuels then. We have alternative forms of energy now. And the fact that we continue to rely upon this old, dirty energy that is harming our health is once again, nuts and bananas. And the next slide, please. So these are just a few examples of how things play out locally. These examples of systemic injustice play out in different ways with different communities all around the world. The common denominator is to power our economy on polluting forms of energy like fossil fuels. Somebody pays that price. And the people who pay that price tend to be the populations that are already at a political disadvantage, are disenfranchised within their countries and their communities. In this country, it tends to be people of color and people living in low-income communities. Being Black in this country is the single greatest predictor, regardless of what your income status is, for being exposed to fossil fuel pollution, which, once again, I'm sorry, I'm like so tired. So bananas that is the case. Huge injustice that needs redressing. I love this quote from Hop Hopkins. He wrote, you can't have climate change without sacrifice zones. You can't have sacrifice zones without disposable people, and you can't have disposable people without racism. The one example I'll highlight here for time is West Oakland, previously thriving Black American community, became encircled in a freeway to prioritize suburban drivers coming in for their work. This community now is just a hotbed for tons of pollution. On the flip side of that, it has also led to really, really inspirational community organizing. There's the West Oakland Indicators Project that's led by Miss Margaret Gordon and residents within West Oakland who have been advocating successfully for their health and for better policies to clean up the air. Next slide, please. Oh shoot, I've gone over time. Very last piece. Wildfires, mental health, and just mental health at large. Amanda and I are pediatricians. We understand that health matters from the time the babies are born. And the first 2 years in particular are very critical because of toxic stress. Climate change is multiplies these toxic stressors. So things like poverty and food insecurity, a caregiver that themselves is struggling with mental health. Climate change threatens all of these factors, threatens to make them worse and expose children to more of these toxic stressors that could place them at risk for a lifetime of poor health. Next slide, please. Okay, I'm going to take any quick questions that folks have. If you have any questions, and then I'm going to turn it over to Amanda, who, now that I've thoroughly depressed the crap out of you, Amanda is going to tell you about what you can do to make a difference.
And we'll also have time for questions at the end. If anybody has a question, Lisa, as she said, is post-call amazingly and heading home to do yet more work. If anyone has a question specifically for Lisa now, speak up. Otherwise, I'm happy to answer questions at the end as well. Okay. I'm going to take that as my cue to move forward. Lisa, thank you. You are my hero. I hope you get some sleep.
Likewise, you're mine. I'm just gonna put my email in the chat here, and y'all prepare to be inspired.
Oh, okay. Hi, everybody. I'm Amanda Millstein, she, her pronouns. As Lisa mentioned, we sometimes consider ourselves forget that term, horse and pony show, whatever show where like Lisa is the bearer of all the bad news. And then I come in and I'm supposed to tell us all how to save the planet. So I cannot promise you that, but I am going to hopefully present an array of advocacy opportunities that we can take collectively to rectify some of the many, many problems that Lisa just presented. And above all, to really try to lay out the case of why we as physicians in particular have voices that are so important and vital to making the change that we need. So really briefly, my story, how I'm here talking to you all. It was not very long ago that I was also sitting in your shoes. I'm a pediatrician. I was a pediatric resident at UCSF. I was not cool enough to be in the global health pathway. I was in the health and society pathway. Shout out to that also cool pathway. And unlike Lisa, I didn't think that this was the pathway that I didn't think that I was going to be working on climate change in any way, 10 years ago when I was finishing residency. So my story of how I got to this particular place starts in 2017. The little boy sitting in that picture is my son, who was 15 months old when we took that photo. He is now 8.5 and in third grade. And that was the morning that my parents, who live in Napa, were evacuated for the first time from their home. This was during what at the time was considered one of the worst wildfire seasons California had, which now, unfortunately, we've surpassed that. The morning we took that photo, my parents had showed up at our doorstep at 4 a.m. with a fire about a mile away from their home. Their home did not burn, though we know with every passing year that it is a possibility. And I also very newly pregnant with my daughter in that photo, who's now 6. At the time, I was practicing pediatrics. I was a new attending at a community clinic in San Leandro, and focused a lot on my own young children, and felt really for the first time, in which I recognize is a very privileged thing to say, a real direct threat to the future for my own kids, and was asking myself this question of what am I doing bringing kids into a world that is quite literally on fire. I did not jump to action at that point. I lived through a few more years of just feeling sort of helpless and feeling more and more like the care that I was providing to my own pediatric patients and the thought that I was putting into, bringing these young children into the world was nothing in the face of what was happening just outside my door. In 2019, through just a series of personal circumstances, I ended up taking a job in Richmond, California, as a primary care pediatrician. For those of you who don't know, probably most of us have driven through Richmond at least and seen the many actually refineries that you drive through as you're headed up into the more northern part of the state. I started practicing in Richmond in the spring of 2019. That picture in the upper right, the bottom one, is an image of the Chevron refinery flaring, which is something that it does quite often as a way of burning off excess chemicals. It creates this very thick black smoke. This is something that the community is extremely aware of. I could actually see Chevron flaring from my exam room. And this was really another huge wake-up call to me, where I had come into this practice being very concerned about climate change, and all of a sudden I found myself in the midst of a community that had been dealing with and is dealing with fossil fuel pollution for decades. One of the very first things that happened when I started at this practice was we all got a Nixle alert on our phone at the same time. We looked out the window, there was dark smoke. Another nearby refinery had had an explosion. There was a shelter-in-place order. To me, not being from Richmond, not having practiced here before, this was all very shocking. And yet, to my patients and to the people who had been working there for much longer than I had, this was just something that happens. Fast forward a few months later, and I went on to co-found an organization called Climate Health Now, which mobilizes and organizes the California health community, which includes all of us, to advocate, to make change that we need to protect our health and protect our climate. And I'll tell you all a little bit more about that as we go. So I want to basically give you all a sense of how many opportunities there are for us to advocate at so many different levels. I always want to start by saying that climate change is a systemic problem and that requires systemic solutions. There is a debate that probably all of us have entered into and heard about, you know, is there a role for individual action? Is it all about systems level change? We can kind of go round and round on that. I think the best framing that I have heard and what I try to embrace, is that no one is perfect, and that is not the point of this. I cook on a gas stove. I have a gas powered car because EVs are pretty expensive, though getting less expensive. That doesn't mean that I can't do this work meaningfully. It means that this is about systems level changes. However, I think there is a role for for personal and individual change, especially if we're doing it in a way that brings others into the conversation and engages the people around us. So there's many different levels of change, and all of them are really important. Again, I'm a pediatrician, so I'm gonna let my pediatric flag fly, but this was a quote that an attending said to me when I was in residency that has always stuck with me, which is that as pediatricians, we are all inherently advocates for the future, and that feels and is so true. I think also as a parent, that becomes very true also, but it's very easy to see when we're taking care of babies and young children how the future really matters for them, and that's what we're gearing up for and thinking about. So first of all, why do our voices matter? They matter because we have a lot of trust from the public. You know, say what you will about how the pandemic and politics have affected that. There is ample evidence that nurses, medical doctors, actually I pulled this graphic last night, this is from 2023, but generally pharmacists are also poll very highly in terms of how the public conceives of us and how much trust they put in us. I don't have it here, but there's actually really interesting data also that shows across partisan lines, looking at people who identify as Republican versus Democratic, the extent to which they trust their personal medical doctor for information. And it's actually even higher among Republicans than Democrats. So there's all sorts of really interesting opportunities for us as messengers. But this is why our voices matter. And climate change is about health. That's, I think, one of the most important messages that we can internalize and also help people to understand, that climate change is about health, and climate solutions, transitioning to renewable energy, making more active transportation, getting off of fossil fuels, all of those things bring immediate benefits to our health. And that's, I think, another huge part of this that is so important for us to understand. When I think about my patients in Richmond, I certainly worry about the impacts of climate change on their health. I worry more about the impacts of that refinery pollution on their health. If that refinery were to shut down or implement tighter pollution controls tomorrow, my patients would benefit nearly immediately. Within a matter of days, the PM 2.5 levels would go down and they would reap the health benefits. So that linkage of climate change is about health. It's about the polar bears too, but it's really about human health and our ability to thrive and the ability of future generations to thrive, and that transitioning off of fossil fuels is also about human health. Those are really key messages to continue to come back to. I'm going to skip over this slide. Lisa touched on this as well, but there is very, very clear data that transitioning off of fossil fuels saves lives and protects health. I, at the risk of being accused of being too political, Lisa and I chose that to include all of this without going into too much detail. Lisa mentioned the Inflation Reduction Act, which is one of the 3 major pieces of climate legislation that's been passed under the current administration. A think tank called Energy Innovation released a report last week that models out what the future could look like under what they call continued climate leadership, versus the plans that are outlined in probably all of us at this point have heard of Project 2025 and plans that alternative administrations are laying out. And it's very stark, right? If you look at this graph on the left, we are now on track to actually meet or come close to meeting our Paris Agreement, our part of the Paris Agreement. That would go away, obviously, entirely. The report from Energy Innovation, I'm happy to provide a link later on, or if you Google it, it's publicly available. Looked at a number of different health outcomes. Just one thing again that spoke to me is looking at asthma attacks under these different models, and clearly it goes without saying that under one pathway we have better outcomes and under another we have worse. So coming back to advocacy and what can we actually do? So my argument is that our voices matter everywhere, right? And in lots of different ways. And even I think as we all know, whether we're in our clinics providing direct, or hospitals providing direct care, or in our communities or with our societies, we are bringing our physician voices wherever we are, and they matter a lot and can make a big difference. I'm also really fond of this quote from Dr. Katharine Hayhoe, who is an evangelistic climate scientist, who says that the most important thing you can do to fight climate change is to talk about it. And that has certainly been my experience. Whether people are talking about it or not, we know that people are concerned about climate change. This is from 2021. You can see that the majority of folks surveyed identified as either alarmed or concerned about climate change. You can also see here on this graph on the right that the number of people identifying as either alarmed or concerned is increasing. This is between 2017 on the left and 2021 on the right. So how can we talk about climate change and how can we incorporate this, into our work as physicians? So at a very hyper, individual patient level, we can apply a climate lens to our patient and family counseling. Lisa talked about now how she counsels about, do you have access to an air purifier and to air conditioning for families she is discharging. Again, I'm a pediatrician. I'm looking at this through that lens, but there's lots of ways to look at this. When I talk to a lot of families about allergies, which is one of the major ways that people are already feeling impacted by climate change. We now have longer allergy seasons that are impacting more people and people at a younger age. So thinking through, when you're talking to individual patients, how can you apply a climate lens? We can encourage and enable families to take action. Probably all of us have heard of Vote ER. If you haven't, please check it out. That's a picture of my actual badge. That's now many years old, but it still works, that enables you to ask families, and I'm going to get to this in a second, really importantly, other health colleagues, about whether they are registered to vote. Obviously, we're not coming anywhere close to saying who to vote for, but voting unto itself is a social determinant of health. Communities that vote at higher rates have better health outcomes. This is something, especially this year, but every year, that's really, really important. And then things like, are there poster projects? Are there ways that you can bring climate change or other topics that are related to climate change into your clinic setting or your hospital setting? Our American Academy of Pediatrics chapter worked on some poster projects where we got very simple messaging up on posters to really try to strike up conversations with families in waiting areas, in exam rooms. It sort of blows my mind continuously that climate change is arguably one of the greatest health threats to all children alive today, and yet you can go into basically any pediatric practice or office and have zero mention of climate change, period. So we need to change that. And this is, some ideas for how to do that. Another lever or layer of this that is extremely important. And sorry, I'm not looking at the chat. So if there's anything I should be focused on, please let me know.
I'll monitor it. I'm just putting in.
Oh, thank you. Oh, thank you. Thank you. The US healthcare sector itself, unfortunately, is a major contributor to climate change. If we were our own country, we would be the 13th largest emitter on the planet. We're about 8.5 to 10% of total greenhouse gas emissions are just coming from the healthcare sector in the US. We got to change that. And the good news is there is a lot of change happening. This slide is probably a little bit outdated now. Perhaps many of you or some of you have heard of the climate pledge that was launched by the US Department of Health and Human Services a few years ago. It's a voluntary pledge that health systems can make that basically commits them to certain sustainability metrics over the course of the next few years. It's important and certainly symbolic. I think how effective and meaningful it is yet to be determined. We're all in some way affiliated with UCSF, which is very much ahead of the curve in terms of what it's doing on sustainability. That's not to say that there isn't huge opportunity for improvement. It's also not to say, I can say that I work at Children's Hospital Oakland, where it is very unclear whether UCSF's commitments even apply to that hospital. So that's, there's, Lisa, I don't think is on anymore. I don't know the extent to Stanford also has made lots of commitments. I don't know the satellite hospital, if the satellite hospitals fall within those. But there is lots and lots of room for improvement here. I think for a lot of us, when we are looking for ways to engage meaningfully, it makes sense to start where we work. And there's so much opportunity here. If this is something that speaks to you, Climate Health Now is going into our second year of a healthcare sustainability fellowship, where we actually have coaching. This year we'll have stipends for people who are actually working on projects where they work. So I'm happy to follow up about that. Other layers at which we can make change are medical societies, which are doing lots and lots of different, pursuing lots of different work. And the reality is very little of it probably has to do with climate change, but there's huge potential there. CMA, which has something like 50,000 physician members in California, does extensive lobbying. Historically, they haven't focused that on climate-related bills. Our theory is if they hear from enough CMA members and we can get enough change there, that we could actually change that. So all of us have various societies that we are members of or could be members of that have leverage that we can help we can help turn the tide there. Sorry, this is a bit out of order. I'm going to jump back to voting for 1 second, and then move ahead. On the topic of getting out the vote, unfortunately, research shows that physicians and other healthcare professionals are actually less likely to vote compared to the general population. It's estimated in 2020 that there were 8 million health professionals in the US who did not vote. So I, as a user of the Vote ER badge myself, fully understand that it can be really challenging to talk to patients about voting. I think talking to our colleagues is equally, if not more, important right now. I wanted to point folks to the Med Society Consortium website, which has an awesome set of pages related specifically to voter civic engagement, getting out the vote. One thing that I think is really awesome as someone who works with residents and trainees is they have a whole set of resources specifically for folks who are in training, who may have moved, who may not have, registered to vote where they moved. So I would definitely encourage you all to take a look, make sure that your co-residents or co-fellows, whomever, are registered to vote where they live. Moving outside of our, hospitals, clinics, medical societies, looking into our communities, what can we do? The answer is a lot. There is a lot to be done and a lot of potential. I just listed a few things that are really important for us in the Bay Area. Before getting to this work, I certainly had never heard of the Bay Area Air Quality Management District. It turns out that they basically regulate all non-movable sources of emissions, is what you can they don't regulate cars, but our refineries, our ports, etc. They manage all of that and set pollution standards. When we go and testify at their meetings or write letters and say, as a physician, this is important, this is why this matters to health, this is what I'm seeing in my patients, we can really straddle that line between this is what the science says and then this is what I'm seeing in my patients, and present a really, really compelling case. Again, as a pediatrician and as a mom, schools are really important, and definitely want to hear from physicians. There's lots of exciting stuff coming down the pipeline related to electric school buses around, there's a big bill in the California legislature right now that would basically set a plan for decarbonizing our K-12 public schools in California, although last year Governor Newsom vetoed it, and he may again this year, but there's lots of potential for advocacy there. Zooming out again at a state level, there's lots going on. A major focus right now of many of the bills that are still alive in the California legislature have to do with polluter accountability. There's a big one that has to do with remediation of idle oil and gas wells in California. I think it's easy to forget that California is an oil and gas producing state. In addition to refining, we're the 6th largest producer if you look at all states across the country. And even in a liberal state like California, there's huge pressures and pushback from the oil and gas industry to not enact any pollution controls, which directly impacts health and impacts climate. There's going to be a climate bond on our ballot in November called Proposition 4. We talked about decarbonization of our schools. The list goes on and on and on. At a federal level, there's lots of opportunity for us to use our voices. The IRA is now in its implementation phase. The jury is still at, how will those dollars be used? How can we use them to maximize health outcomes? How can we get that money to the places that need it most? Lisa did an excellent job of laying out what populations are most impacted by air pollution and by climate change. How can we make sure that those dollars are getting to those communities? And I think the question for us as physicians is how can we best help ally ourselves with those communities and advocate for them so that they can see the benefit of this funding. There's negotiation going on with a farm bill. I can share a link out to an easy letter that we can all sign, asking for the politicians negotiating the new farm bill to prioritize health and climate. So the bottom line is our voices matter. There are so many ways that we can use them. The world, as I like to think of it, is sort of our oyster. I'm going to close out with this graphic from Dr. Ayanna Elizabeth Johnson, who's a marine biologist, who created this Venn diagram of like, how do I figure out what I'm going to do? So you're looking for something that's at the intersection of what are you good at? What skills do you have? I mean, we're all doctors. I know many of us have lots of other skills as well, but that's a place to start. What brings you joy? This is pretty hard work, and it can be hard to feel hopeful, though I would argue not impossible. But what makes you happy? What's your contribution going to be? And what is the work that needs doing? And you're kind of looking for that sweet spot, and it may change over time, and that's okay. But I find this a really helpful framework. And then we just wanted to close out with some save the dates, and we'll share out some links about this after. If you're like feeling inspired, you want to get involved, you want to do something else. I mean, we live in a place and are part of a university that has so much going on, just a sort of random smattering of events. Stanford is hosting a healthcare sustainability half-day conference in a few weeks. You can get CME. My organization, Climate Health Now, has a bunch of upcoming general education on heat and health. We're inviting climate journalist Amy Westervelt to come talk to us about messaging. Next month, we've got some pediatric psychiatrists talking about child mental health and climate change. Lisa is involved in a conference coming up in November in San Francisco that's looking at the role of health informatics and AI in climate change, health, and equity, sponsored by Google, which is kind of cool, on the news. So that's it. I'm going to close this out with a few more minutes. This is a huge problem. Don't go it alone. Find a group, whatever that group, it could be your clinic pod, it could be your church group, it could be your medical society, it could be Climate Health Now, the Med Society Consortium. There's so many groups, but my biggest advice is don't go it alone. So join us. And that's it.
Oh, thank you so much, Amanda. And to Lisa as well, I know she had to go. We'll open it up to questions. Either feel free to come off mute or put it in the chat. And then also to say that we've put a link in the chat as well. We really do appreciate your feedback. Super short form, so please take a moment to fill that out too. Questions from the group? I can start things off. Lisa mentioned how she's incorporated climate change into her kind of anticipatory guidance, especially in the newborn nursery. How have you incorporated this work into your messaging to patients? And then the follow-up question to that is, do you have helpful resources for pediatricians in terms of like flyers or pamphlets, or where do you direct your patients and their families to go for more information?
That's, I think, a really hard question. I don't know the answer to that. Like, I am still trying to figure that out because there's a lot that is out of the nexus of control of our patients and families. And I feel very hyper aware of that. So I don't ever want to make families feel guilty or at fault for anything that they're doing. So I think often in a clinical setting, I mean, the first priority is making sure that that my patient and the family are safe. So things like, do you have access to an air vent, filtration? There have been seasons where I have, handed out printouts of like how to DIY your own air filter at home? Or where can you get, like where is the community setting up clean, they call it like clean air centers, essentially, which obviously with COVID would pose extra challenges of like, was it safe to go there? Counseling, especially for newborns as well, around how to keep newborns safe during heat waves. The temptation always is to bundle and to do all of these things, and do families really really counseling families about what to do. So as a pediatrician, for me, the AAP has some really actually great resources, and is increasingly incorporating sort of climate counseling into something called healthychildren.org, which is what auto-populates a lot of our like the guidance that goes into our ADSs, et cetera. But I think a lot of it is really being familiar with the community where you're practicing. So generally I actually need to do this now because I am now practicing primarily in a different city, but I try like over the summer to familiarize myself with like, okay, when I was practicing in Richmond, like where are the clean air centers? What is the community doing to keep folks safe? And how can I make sure that I get this information to patients if it comes up? Things like that. There's programs, actually the Bay Area Air Quality Management District did run a program where you could get a free air filtration setup. I don't know if they're doing it again this year. They had a limited set of funding to do this, but things like that. Do you know what those resources are and how can you connect folks to them? I think the harder part, honestly, is talking about mitigation with families. Like it may, like I started out by saying I have a gas, I have a gas stove, I drive a gas car. It is not reasonable to tell folks to go out and make those changes. But I think I would say I'm still trying to figure out when that comes up in conversation, how to talk about that with families. I think, for example, the gas stove issue is especially relevant for pediatrics because that's what a lot of the studies have shown, linkages between cooking on a gas stove and asthma. And there are ways to mitigate the health risks of a gas stove. Do you have adequate ventilation? Do you have a hood that you can turn on? Is there a window you can open? Those sorts of things. But it's very hard, I would say. And I don't feel like I've mastered it at all.
Yeah, I agree. It's hard. Any other questions from the group? I realize we're at time. Actually went over a little bit. Thank you for putting your email in the chat. If people have follow-up questions, is it okay if they reach out to you?
Of course, absolutely. Yes. Sorry for being a little over.
Oh, no, this is a great talk. Really appreciate your time.
Awesome.
All right, we'll see you again soon.